Good afternoon, ladies and gentlemen, and welcome to Oldham County Fiscal Court. I'm David Vogel, Judge Executive. Apologize for getting this meeting started about 12 or 13 minutes after our normal starting time. As you might expect, a problem came up right at the 10-2 that needed resolved. We have that issue resolved, so we're able to go forward. So I appreciate your indulgence and would everyone able please stand for the Pledge of Allegiance? I pledge allegiance to the republic which stands one nation, under liberty. Denise, will you please call the roll?
Magistrate Lights.
Here.
Magistrate Ice. Magistrate Woosley. Magistrate Greenwell. Magistrate Hounds. Magistrate Hawkins. Magistrate Dye.
Here.
Magistrate Logston. Judge Vogel.
Having all members of the fiscal court present, this meeting is now in session. Is there a motion to the agenda? Moved. Are there any additions? Hearing none, all in favor, please say aye. Aye. Motion carries. Thank you. We have for us minutes for October 19th and October 27th.
Judge, sorry. I think we need to remove something from the,
Sorry, did I miss? Sorry, what was it?
under community business B.
Which one?
Second reading.
Oh, I'm sorry.
Or ourselves. Tom.
Well, wait a minute, not yet. Okay.
He was going to tell us why we got to remove
Okay,
it.
all right, Tom, go ahead. That's we're removing the second reading for the amendment for Parkside Estates, 1909 East Jericho Road and Hoffman Lane. Right, go ahead.
Right, Judge, the attorney for the applicant did test positive for coronavirus afternoon, and we respectfully request that the second reading and public hearing the November 16th fiscal meeting.
All right, because of illness. Agreeable to that?
Time to advertise.
Yes.
I will go back out to the site and re-advertise, put the new meeting date on the sign, as well as send out the mailers with the correct time and date.
Your date?
It's a fiscal court hearing, so that'll be the 16th of November.
All right, thank you. Now, we had two minutes to go through October 19th and October 27th.
The Oldham Fiscal Court convened a regular meeting at 2 p.m. with Executive David Vogel, County Attorney John Carter, the following magistrates in attendance: Brent Likens, Wayne Tice, Steve Greenwell, Chris Hounds, Bob Dye, and Mike Logston. Magistrate Kevin Woosley was absent. Motion made by Magistrate Dye and seconded by Magistrate Hounds to approve the agenda. Motion carried unanimously. Made by Magistrate Logston and seconded by Magistrate Greenwell to approve the meeting minutes from October 5th, 2021. Following corrections on page 394 during the second public comment piece was corrected to 10166 Mailback Way, and a note was to reflect County Engineer Jim Silliman's findings. Motion carried with Magistrate Hounds abstaining. The following sealed grant applications for the broadband deployment grant were opened and read aloud. All Points Broadband, AT&T, Silica Broadband Lit Communities, Spectrum, Zoom Broadband Services. These applications were provided to the Broadband Committee for you and recommending. Motion made by Magistrate Logston and seconded by Magistrate Tice to authorize payment of the payable. Motion carried unanimously. Motion made by Magistrate Hounds and seconded by Magistrate Dye to authorize budget transfers in the amount of $20,429.08 for the quarter 9/30/2021. Motion carried unanimously. Motion by Magistrate Dye and seconded by Magistrate Logston to adopt ordinance for KOC 211-20-273, amending the existing Oldham County budget for fiscal year 2021-2022. Motion carried unanimously. Tom McIntyre, Senior Planner for Oldham County Planning and Development Services, presented for first reading the zoning map amendment for Parkside Estates, 109 East Jericho Road and 419 Hoffman Lane. Motion made by Magistrate Hound, seconded by Magistrate Green to hire Jeremiah Herod as a 3-year rural officer at a base hourly rate of $22.31 effective 11/22/2021. Motion carried unanimously. Motion made by Magistrate Greenwell and seconded by Magistrate Hounds to promote Stephen Jenkins to sergeant at $29.38 an hour effective 10/20/2021. Motion carried unanimously. The following resignations were announced. Jay Grace from the Police Department effective 10/3/2021, and Chris Clark, Enforcement Officer effective 10/29/2021. Motion made by Magistrate Hawkins and seconded by Magistrate Hounds to reappoint J. Scott Judy to the Code Enforcement Board for a term to expire 10/16/2024. Motion unanimous. Motion made by Magistrate Greenwell and seconded by Magistrate Hounds to adjourn the meeting. Motion carried unanimously. Meeting adjourned at 4:12 p.m.
You've heard the reading of our minutes from October 19th. Are there motion to approve? So moved. Discussion. All in favor, please say aye. Opposed? Carries. The minutes from October 7th.
The Oldham County Fiscal Court convened at a special meeting at 11 a.m. with Judge Executive Vogel, County Attorney Carter, and the following matters in attendance: Brent Likens, Wayne Tice, Kevin Woolley, Steve Greenwell, Chris Jones, Bob Dye, and Stephanie Hawkins. Michael Loxton was absent. Motion made by Magistrate Dye, seconded by Magistrate Hounds to approve Tina Shaw's Fiscal Court Clerk for the meeting. Motion carried unanimously. Motion by Magistrate Hounds and seconded by Magistrate Woosley to approve the agenda as submitted. Motion carried unanimously. Court entered into executive session upon unanimous approval pursuant to KRS 61.8101F, discussions or hearings which might lead to the appointment, discipline, or dismissal of an individual employee. Motion made by Magistrate Greenwell and seconded by Magistrate Hounds to reconvene the open meeting. Motion carried unanimously. Motion made by Magistrate Dye and seconded by Magistrate Greenwell to adjourn the meeting. Motion carried unanimously. The meeting adjourned at 27 p.m.
You've heard the reading of minutes from October 27th. Is there a motion to approve?
Second.
Discussion. All in favor, please say aye. Motion carries. And now to move on to the first item on our agenda today, and that is we welcome back Matt Rhodes, Director of the Oldham County Health Department. Nice to see you here, Matt, and we hope that you're bringing good, at least neutral to good news.
We do have some encouraging news to share, so let me type in the password here. That's it. Okay. Well, there are several different slides here. The first one I'm going to share is the information from the Kentucky for Public Health slide deck. There are a lot of sites here, but I guess the primary point that we are trending in a very positive direction. Thankfully, the transmission or the incident is starting to decrease quite nicely for the entire state and for us here locally in Oldham County. I'm going to get to the presentation. Is there a specific button I can click for the slideshow? I don't see the little symbol. Other than that.
Pull up that pointer, wasn't it? There you go.
So this information, as I said, is from the Kentucky Public Health shared tonight, and it will show encouraging signs as it relates to the coronavirus. Key points. This is the deep data that shows the Kentucky case count compared to the United States and the world. Our mortality rate, our case fatality is lower than the rest of the world. You all may have heard just this week that the pandemic has taken over 5 million lives across the world, and we've had 740-some thousand deaths in the United States. This just shows the current, our latest surge and how we're trending down with counts. It's a very jumbled graph there, but it looks at all different locations across the world. And this shows our United States case count by date reported, and although there's an overlay with vaccinated, but the prime point is just to look at the downward trend you can see here with regards to case counts in the state of Kentucky. Some other graphical illustrations on this bar graph that shows you can see where we were back in January, where we thought we had a high count. Actually exceeded that this latest surge in September, but the most recent case count shows that we're starting to decrease exponentially like we increased. This is the 7-day incident rate map. You can see for Oldham County, we're down to 12.6. The red or high zone is greater than 2025, so about half of that in the current 7-day rolling average. The state, the overall current incident rate of the state is 22.35. So we're starting a lot more orange, yellow, and even one green, which is an indication that the disease prevalence is starting to wane. The positivity rate across the state is 5.03%, which is encouraging. You might recall back towards the height of this latest surge, we were up close to 15% with positivity rate. The deaths, you see the latest surge. It looks like it has peaked. We are still losing Kentuckians, but thankfully we're losing fewer as we go day by day. I'm going to skip through some of these slides here and then show some hospital data. This is encouraging. One of the things that we were challenged locally and across the state is the hospacity, and you can see that back in January, the peak was 1,817 patients, and September and October we eclipsed that 2,526. The latest data as of yesterday, 772. We're also seeing a steep decrease in ICU patients and patients on ventilators, which is very encouraging. And this is a hospital capacity region. We're in region. Just probably 4 or 5 weeks ago, we were at 100% on our ICU bed capacity, and we've dropped down to 7.5%. So they've really increased capacity there. And then the inpatient bed capacity has grown to 70.3, which means that they have 30% capacity available. And you all have heard every week how the situation looked at those different hospital facilities. This is the COVID vaccination data, and it looks at the rate of cases for the unvaccinated versus the fully vaccinated. And you can see there is a disparity, but we are seeing many breakthrough cases, and I'll share some of the in the local data we share here. And looks at I think true risk of death as it relates to COVID from July to October 2021. And you can consider that for those over 60, there's still some risk of dying for fully vaccinated populations, and especially those over 70. In most cases, they have underlying health conditions. But still, for the unvaccinated, there's a much greater risk of dying. So still want to encourage vaccination throughout the community. And this looks at the case data for hospitalizations and death. You can see since March 1 of this year, we've had 327,000 cases across the state. Hospitalization data breaks that the distribution for case count amongst vaccinated and unvaccinated, 80.1% in your unvaccinated population versus 15.9%. For hospitalizations, that is 84.22% for unvaccinated and 15.8% for fully vaccinated. And then your death, 85% for the unvaccinated, 15% for fully vaccinated. And this is just a pie chart distribution of the death distribution pre and post Delta. And you see that still largely for those that are sitting over, they may make up a large share of individuals that have died prior to Delta and post Delta, but those numbers shifted somewhat to younger populations. Those 50 to 69 have increased from 34% to 36%, and those in the 30 to 49 age range grew from 2% to 13%, and likewise in the 8 to 29 population grew from 0 up to 2%. So I'll stop there and then share some of the local data. We pull that up.
Have to go back.
Which slide?
Five slides. It was the one where it was shown that, at one time, there was a big correlation between unvaccinated and vaccinated getting COVID. And it looks like it's kind of shrinking down where, more people that are vaccinated it are getting more, it's coming down to where the people not vaccinated, I don't remember percentage of it, but I was wondering if that was because people's immunity is running off the first two and if booster to get to bring it back. It was about five slides back, but it was showing us
Here.
back down and they were kind of even and out.
And I think what you're referencing here is the October month that we're looking at on the screen now. And it does look like that number, the discrepancy has shrank. And I think that I can speak on the local level as well. And I think it's, spot on to what your point is. It seems like the immunity may be waning if we're vaccinated. And that's the reason that the booster vaccines have been approved. And I'll talk to that later as well. We did finally get approval and registration set up to start offering them locally at the health department, and other providers are offering those boosters as well.
I just didn't want you to get far away from that and not be able to go back.
Good point. Thank you. There's a great data to share. This is the local data that looks at data from June the 6th. Does it? And this, we really started collecting this in July because we started seeing an uptick, and it appeared that we were going to have a surge with this Delta variant, and that it was the case. But happy to see that it appears that we've peaked and are going back down. But you can see over in June, we had very few cases through the month of June. The 1st of July is week 27 here, and we started an exponential climb where we peaked around week 35, and we've started this decline. We had an exponential growth week over week. We started down at the same trend. Unfortunately, a few weeks back, we kind of leveled off. We've sort of gone down, but we are continuing to go down. This is indicative of our incident rate for the community where we're 12.6. And as you can, we started an edge distribution because we were concerned because we thought we would start seeing more children be impacted or more pediatric cases be impacted, and that was in fact the case. Started tracking, and you see that the orange represents the 12 to 17 age range, and then the gray represents the 11 and under. And there is tentative approval. The Advisory Committee on Immunization Practices is meeting this to give final approval for children in the 5 to 11 age range to be vaccinated as well. And there's good expectation that will be approved. So we'll be able to start providing vaccine for that population too. The descriptive statistics over that 22-week period that we tracked through the Delta variant, total cases age 18 and older, 1708. Total cases 12 to 17. You can see there with those two groups added together for pediatric cases, still over 30% for the total case count. In pediatrics, here, you might recall I stood here about 18 weeks ago and started talking about it appeared that we were going to have a surge over that 22-week period. We've had 42 hospitalizations for Oldham County residents, aging in range from 2 to 6. There were 40, 18 and over, and 2 peds hospitalizations. In total, there were 35 that were unvaccinated. 1 case was under the age for vaccine requirement, but 7 cases were vaccinated that had to be hospitalized. And we lost 10 Oldham County residents during that time period. 9 were unvaccinated, and 1 was fully vaccinated.
And were those deaths adults? Weren't any children in there?
Right, all adults, correct. There were no peds deaths from Oldham County we are aware of.
Did any of the uptick with the smaller kids correspond to the opening of school, or since school has been underway?
We can say that It's definitely correlated with the opening of the school, but that's just, I think a timing, and we were starting to see I can't say that it's a cause effect. But yes, it does correlate with the opening of school, because around August the 9th is when we really started to see an uptick of cases, and I think school started August the 11th. And this speaks to locally with I think we may have higher breakthrough rate locally than some other locales, but we've had 612 of our cases over this last 22-week period be breakthrough cases, and the breakthrough cases about 24.8%. That's a fairly large number, which I think does speak to the fact that immunity may be winning from vaccines. We also know that the data clearly suggests that it is the Moderna vaccine had greater efficacy, followed by the Pfizer vaccine, and then last the Johnson or Janssen vaccine, which is a single dose vaccine. And this looks at the different variant data, as I had showed you all before. There's a semi-random process by where they collect samples for individuals who've been identified as positive for COVID, and they send it off for genomic sequencing. Of the 189 samples, 22 were not suitable for testing, but you can see 130 of those were identified as the Delta variant, which is almost 80% of all the samples that could be sequenced were actually the variant. There were still some others circulating around, but the primary effect was the Delta variant in the latest surge. And I want to follow up question that Magistrate Hawk had asked the last time that I was here about different mental health factors, if we were tracking that, and we have been looking at things. There's a lot of competing priorities, as you all might imagine, and a lot of the data that public health has used just historically prior to this pandemic is 2 or 3 years old, and the need for real-time data is truly a challenge. So we were able to identify this essence data, which is enrollment data, captured intake, healthcare facilities. And really it's measured by percentage of individuals report, and it's labeled by a qualifier of normal, warning, and alert. And as I was saying to Mr. Hawkins, a lot of data is proprietary in nature, and you can share it publicly or show it publicly, but I'm trying to get approval so that when I come back in, that I can show you all in graphical form so that you can see it. But I went through the data sets and just tracked, because it's a 5-year data set from 2016 up to current time, 2021. And typically when you look at certain health behaviors, obviously you think about suicide, harm, overdose, and then in many cases, violence. We've seen most recently, I was able to capture the data for both suicide, self-harm, and overdose. And I wanted to share with you some of the highlights. Looking at the weekly percentage of self-harm and suicide-related events from 2016 to 2021 in Oldham County. In 2017, and like I said, they qualify this data by evaluating it. It's normal, has a normal distribution. If it's elevated, it's a warning, and then if it's really elevated above what you would normally expect to see, it's identified as an alert. 2017 and 19, we had 1 alert. 17, 4 alerts in 2018, and 2019, 1 alert and 1 warning. 2020, which corresponds with the start of the pandemic, had 3 alerts, and then in 2021, we've had 1 warning, which was at the start of 2021. And so I'm happy to say that the data since that time has indicated a normal distribution. And then lastly, weekly percentage of opioid overdoses in Oldham County. And I think, I've heard anecdotally from individuals that we're seeing an increase that locally. And it does suggest that was the case. 16, 17, and 18, there were no alerts or warnings, but in 19, we had 1 alert. And then in 2020, we had 4 alerts for opioid OD events. And then for heroin OD events, we've seen 2018 warning, 2019 an alert, 2020 1 warning, 1 alert. And in 2021, we've had an alert, but since we haven't seen other spikes in those, thankfully.
On that, may I ask something? You say the alert is higher than the warning. But then you called it an overdose. So overdose result in death or no?
Well, I didn't go back and calculate for the ones that, this is hospital admission data. So alert is higher than a warning. And basically what they do is they look at all of the intake data, and based upon the historical record, they're able to determine that it's statistically significantly different from previous years. And these alerts warnings indicate that there is a difference. Other times there's no difference. It's a normal distribution. The alert and the warning indicate there are things that are sort of outside of the normal range.
Alert could be a death or it could be a death.
This means there's more cases of that. It doesn't indicate whether death or a non-death related dose. It just indicates that there's actually more overdose events. Like I said, I'm going to try to get approval for this data set to come back and show you all graphically so you can kind of see how it's distributed. And then the last thing that I wanted to share with you all is just that we did get approval for boosters, and basically one that wants booster shot now is eligible. There are previously you all may have heard, and there's been challenging wordsmith with boosters versus what referred to as a third additional dose for those that are immunocompromised. So you might recall previous year there was an approval for what has been mislabeled as boosters for immunocompromised. That's actually been done as a third additional dose to complete their. What was the data indicated was a lot of individuals that were immunosuppressed didn't develop the level of antibodies needed for protection, so they actually needed a third additional dose, which can be administered 2 months after their second dose, or the mRNA vaccine, or Pfizer or Moderna. And now, because of waning immunity, individuals that meet the category 65 and older, or in special classifications, anyone basically 18 and over can qualify now. Because of waning immunity, 6 months after completion of your series, you can get a booster dose. And we were able to get the registrations online this morning. We've posted 100 appointments for this Thursday, and are going to start administering those vaccines this week.
And you have all vaccines, or so if you had the Moderna, you would get Moderna. If you had a Pfizer, you get a Pfizer, and so forth.
Typically speaking, that's so recommended, but just to make it even more complicated, they have said that you can mix and match with the boosters from the first dose that you received. So I think the reason that they're doing that is because some of the vaccines haven't shown as of efficacy as others. They want to give individuals an opportunity, if they've had a Johnson & Johnson, maybe to a Moderna and Pfizer booster.
Right. Thank you. Any follow-up questions here? Mr. Woosley?
Rhodes, at what age are you now eligible to get the shot? And well, answer that question. I'll ask in a second.
Right now, anyone 12 is eligible for the vaccine, and that's Pfizer. For booster, anyone 18 and over has been approved for booster. And Advisory Committee for Immunization Practices is meeting this week. We approved Pfizer for 5 to 11. So hopeful by the end of the week, anyone 5 and over will be eligible for vaccine.
And if someone wanted to tell us the website that they need to go register for the health department to get that shot.
Thank you. It's www.oldhamcountyhealthdepartment.org. Probably the website in history, but spell out oldhamhealthdepartment.org, and you can access the registration.
Magic Likens.
Judge, is third dose your booster? Is that the same stuff as you took your first two? Same.
It's complicated. Yes, it is. But for those that are immunocompromised, they get a full dose if they get a third additional dose. If you get a booster dose for Pfizer, the full dose, but for Moderna, because the efficacy is greater, you only get a half dose.
Can you have your antibody checked to see if you need a third dose or if you need a booster instead of just going and getting it?
There may be some entities out there that can check antibodies and provide that information. I would refer you to your primary care provider, that information. I'm not familiar with who is doing that currently. There are entities that can do that. I know still the CDC doesn't necessarily look at antibody testing as a correlate for immunity. So, but there are entities that can test antibodies, sure.
And I don't want to be the last person in the world that dies from COVID, but you didn't have your mask on today, and I don't know whether to be alarmed. Masks, not mask. People wearing masks in the car. People not wearing them at all. I don't know what to do at this point.
And I did wear the mask in, but getting up to the microphone, I think it's safe enough now to take it off so that everyone can hear me clearly. People in their car by themselves do not need to wear a mask. Obviously, individuals that are having indoor interactions with individuals outside their household probably should still practice precaution and wear a mask as long as in those exchanges. It is a challenge because when you go out in the community, you see fewer and fewer people wearing masks, and I think that they've, in some cases, gotten a sense of security. And obviously, there's a lot of back and forth on mask and efficacy mask and so forth. And obviously, they're not perfect, they're not a panacea, but they're just another tool chest to try to mitigate the transmission of this virus.
Measured hounds.
You Judge. Well, I think you've now, your sentence has been communicated over a year now. Congratulations on being with the health department for a year, and appreciate your leadership that through this whole pandemic. And like we were talking about earlier, you can write a book about it, and we'll just keep it for somebody else to have use.
Thank you very much. It's I was talking with my wife this morning, and this year's been a dog years, I think, but it's been a labor of love. Made a commitment to the community, and I'm glad that I did. So thank you.
Mentions Logston.
Smith, and second motion there. I'm glad you're here helping us out. My question is, and it's really starting to concern me a little bit, but everybody in Oldham County got the Moderna shots. All given out. You might give out Pfizer now, but when we first got our shots, it was all Moderna, and I can't find anywhere where the CDC has given final approval for. I know Pfizer has gotten their final approval. You see, or have you heard anywhere where Moderna is going to get their final approval on the shots? I hate to take this approval, and that might be holding back a lot of people from getting the shots. Do you have any idea when they're going to get the final approval?
I do not. It's in the I don't know what specific timeline is. I know that they are moving forward with that request.
We keep pushing it back a month.
Will eventually happen. It's just I don't know what definitive timeline is, but your point is valid.
Well, Matt, thank you for being here. We certainly appreciate the update and the slides and the more insight into what's going on. So,
Thank you.
all right, and we'll keep pushing those shots. Have your person, can't think of Kristen or whoever is your public relations person, be in contact with Denise with the latest information so we can put it on our digital signs.
Okay. Thank
you very much. Next item on the agenda today here is to do with public comment. Is there anybody here who came in who would like to address the fiscal at this point? No one. I'll close public comment and go on to our item on the payables. I might add that many of you may have received communication late today regarding the amount of money for per property. There were some questions with that communication that may have been raised, but all those questions have been resolved, and that settlement or closing is set to go as approved by the county attorney office on Thursday of this week. So there's a motion. I'm happy to accept that.
So moved.
Discussion. Magistrate Tice.
I have a question on the addition to the payables on the property. Um, two concerns of mine. Number one is we have not approved the building for the health center that we need to be surprised for. And my second question is, as the people that we're buying the property from, their future entrance, egress, whatever, onto 393 might require more room than what they will be left with. So I have those two concerns. There's a difference in between a road just go for residential and a road width that we need for a commercial or industrial development, which could be an industrial development. So I have those two concerns about that.
Well, my response in that regard would be that the property owner is not concerned about his egress is off 393 in the future. He was willing to sell property. And the second thing is that even though the animal control building has not been the total resolved, regardless of come up with there, we think we need that additional property. But just don't build it there, period. So.
We have not had in a closed session for property acquisition and this rather than just on the past.
I don't think so. Woosley?
I just want to follow up on that. I also have some concerns on, has it been assessed? I mean, we're looking at a 35-foot, about 300-foot long strip.
Judge,
Probably been assessed to value that we were paying 50,000.
Yes, it
I mean,
has.
appraised, yes, not
yes,
assessed.
appraised. It certainly was.
It appraised at 50.
Right. And you should die.
To follow on Magistrate's question about the egress, you said that the property owner that doesn't have any future interest in that property for egress, or is it to come across our property to get out of their property?
No, it's not by contract.
Okay, so are you saying they will be able to if we decide to?
Well, I'm not actually saying anything about it. I'm saying that we asked to purchase a strip 35 by whatever it was. They were willing to do it. And that's about all there is to it. I don't think that we need to worry about future egress to the property if he's not worried about it.
That's what I'm trying to get at is there's no quid pro quo on this. In other words, they're going to be able to, at some later date, ask for permission and.
Well, I'm not saying that they can't ask. There is nothing in agreement that requires us to give it.
75 feet wide. We're not in the whole 75 feet.
Right.
Other things.
That's leaving them with quite a bit there.
Okay, that's what I want.
County Engineer Jimson, the width that's remaining was determined to leave the approved, it's greater than 40 feet, which is what's required for 40 an excess easement. So that was the determination of width.
My comment was based on some of the comments we've had in the past about his property. So if the dimensions and shape and all of that's changed,
right,
that may have changed the.
Right, it may have. I mean, I can't remember what the original thing was. I think we're going to say there's something when we moved over to the left to give him enough space on the right if he did want.
But you don't remember if I kind of do. I'm checking.
Anyone else? Anything on the payables here? Right.
There is a standing tax bill for 20 on this property.
Just mentioned at the beginning that all issues have been resolved. That will be paid. And Tice, did you have another one?
I just have concern with this, as I would like to deal with approval on this piece of property individually rather than to be all with the other payables.
Approve the motion.
Pardon me?
As I would like to, because this came up as a late and there possibly concerns, I'd like to do it both the payable two forms. One that that we got over the weekend, and this other one itself. And court votes for it, we didn't pay for it.
There's already a motion on the table to,
There's a motion on the floor, pay this, okay.
And amend it.
Unless the person who made the motion to amend it.
I made the motion. I'm not willing to amend it. I made the motion. I'm not willing to amend.
All right, seeing other questions, all in favor, please say aye.
Aye.
Anyone opposed?
Post.
Hey, I'm asked clerk to call the roll.
Magistrate Logston,
Motion pay bills. Pay the bills.
Magistrate Hawkins, Magistrate Lights, Magistrate Woosley.
No.
Magistrate Holmes, Magistrate Dye, Judge Vogel,
We have it.
Magistrate Tice, Magistrate Greenwell.
Motion carries 4. Thank you. Next item on the agenda was crossed off, so we'll go on to C under community business. I have received the two proclamations here. They're both lengthy. You've had a chance to read them. I'll try to summarize them. Proclamation number 1, a request that we proclaim November 7th through the 13th of this year as Nurse Practitioner Week in Oldham County. And it's a national event. We all that nurse practitioners provide extremely valuable service and assisting physicians both in their offices, and they also practice in hospitals. Nurse practitioners have an LL degree of training beyond just registered or licensed practical nurses. They're a valuable part of our medical overall medical team, and we certainly salute all nurse practitioners working in Oldham County. So is the motion to approve this proclamation?
Second.
All in favor, please sign.
Aye.
Carry. Next proclamation we received here was designating Oldham as a constitutional county. We are all aware of the fact that there are issues across the country that are being debated. A number of people feel that the Constitution and its provisions are being infringed upon in one way or another by the Biden administration and the departments of the administration. This constitutional proclamation declares that Oldham County is a constitutional county, and it, as such, observes all rights granted under the Bill of Rights, and that the court recognizes the government must be limited, and that the people must be free from unnecessary and arbitrary government overreach and intrusions, and that the members of Oldham County Fiscal Court are unwavering in their support of the Constitution of the United States and the provisions and the Bill of Rights and the aspects that are afforded all Americans under the Constitution. So is there a motion to approve this proclamation? All in favor, please say aye.
Aye.
Carries. Thank you. And we will post that on our website. Next item on the agenda is under committee reports and recommendations. I believe the Human Resources Committee has a report regarding our 2022 benefit renewal. Magistrate Logston.
The Human Resources Committee met, and in your package all weekend long to see it, there's I'm gonna have Tina come up and explain it, but I'll make the motion to accept the renewal for the 2022 insurance, and then if somebody gets a second, then we can have Tina talk it.
Second.
All right, motion made and accepted to approve the rule for the 2022 benefit package. Or at least that's the dental part of the benefit package.
On discussion.
Right, discussion. All right, Tina, do you want to just go through what's on paper?
Before you all is the renewal for next year. The renewal came at a 9% increase for the medical. Initially at 17%, but then negotiated it down to 9%. That was including our wellness benefits and our activity in that program as well. It came back at 4% increase. So that's what the employee pays. We're going to get that increase for this year. Those the cost for those is listed on your memo that so you see that listed and what it's going to cost the employee per month for that percent increase on their mental. Then vision was locked in for 2 years at a rate hold. So now we're recommending that we keep the county contribution on the medical the same. So the employee will see no change in their deductions. And all the other benefits, HSA, HA, life insurance, short-term, long-term, everything else stays the same.
All right, are there any questions on this? Magistrate Dye.
Yes, Tina, what is the increase? You said you did back up. County picking up the increase. Please.
Is picking up the 9% increase in the medical.
And he will not see
their contributions.
9%
104,000.
Total.
the employee. Is that what is that number here?
And what do you mean? For the medical?
Employee, and it's not going to go up, but it's going up 9% to the county. How much, honey? What is that 9% in dollars and cents?
$4,000. It's on
How about per person?
Person? Let's see. Well, I don't know. It's you look at the renewal and it's going to be based on the tier of coverage. So it's different each one. So you figure we had our rates for the coverage insurance was $449 a month. And then this year it'll be $490. So, and then it goes on for each tier. And that's a spreadsheet that you have.
Right. I just want people to, I just want to gloss us over that benefit that the employees are getting that the county picking up instead of taking it out of their pocket. I mean, that's maybe I'm just old school, but that's sort of a reason pay, not reduction in net, what they would bring home. So, I mean, so they're this is just yet another thing to benefit package. Some people don't see it that way. So I don't want to gloss over the fact that we're saving them some money and they're not losing any of their coverage. So.
I wouldn't call it raise and pay. I would call it neutral. Not going to get an extra deduction off their insurance.
Can't
Raise. Raise and pay. They're just not getting an increase on their insurance.
Not a deduct their net by paying part of the increase.
We could have, but we didn't.
Correct. How much?
Magistrate Dye.
190.
Reading through this, and I can send you this note on the vision benefit. There's Humana, Dental Care Plus, Delta, and Anthem.
Looking at the renewal, those are the companies that all bid.
And okay, now
Coverage, you're looking at everybody else submitted with Humana's renewal project to us.
now that makes sense. Okay, I was like, oh, I got to choose one.
Don't.
Magistrate Hawkins.
You mentioned the 9% was being absorbed by the county. Is that just for the employee coverage, or is that the family, the employee child, employee spouse, all medical, just for the employee?
The employee that pays premiums is going to continue to pay the same premium paid last year. So the increase in the premiums the county is absorbing.
Any other questions about this cost? All right, we've got a motion on the floor. All in favor, please say aye.
Aye.
Anyone opposed? Motion carries. Thank you. Next item here has to do with the road committee recommendations. And Manager Greenwell.
Thank you, Judge. The road committee met today, and the first one we recommend to accept D.W. Griffith into the county rodents list unanimously. And I would make that motion court.
All right. How much was involved there? Recommendation accepted into the system, so there's no money involved. Okay.
Standards and there was no bond.
Right, no bond.
So there's no need to release.
All right. Got him in the second to bring in D.W. Griffith Lane. Where exactly is that?
That's where the drive-in is.
Okay.
Parkway.
Drive-in. Okay,
Yes.
right. Yeah. Any questions on this? All in favor, please say aye.
Aye.
Anyone want to oppose? Motion carries. Next item is to reduce the Grand Oak Section 5 erosion control bond. Committee recommendation.
We also met and talked about this and voted to recommend that we decrease the amount of the bond by 50%. And so that would leave the remaining amount to be $19,650. This is for Grand Oak Section 5, and I want a motion.
Second.
Moved in second. Are there any questions for Mr. Summon regarding this reduction? All right, hearing no questions, all in favor, please say
Aye.
Motion carries. All right, thank you. That was easy enough, right?
Ask the question beforehand.
All right, next item has to do with personnel matters here. Ms. Huff?
Manager steps in.
We're replenishing our maintenance department. It's so exciting. We have 3 new hires. We have 2 full-time. Everyone's going to start on the 8th, next Monday. The first is Scott Woosley. He'll be maintenance at $18 an hour. Hunter Hamilton at $17 an hour, and Kenny Randolph is going to come back part-time, 20 a week, $20 an hour.
Approve.
Moved in second, then we hire these employees and re-employ Kenny Randolph part-time. Any discussion on that? As you should do.
I did.
As you Woosley.
Are you related to the Woosley there?
I thought I know there's a bunch of them. So
Kenny back.
Right. We're glad he's come back. All right. All in favor, please say aye. Anyone opposed? Motion carries. All right. Regarding appointments here, I'd like to reappoint Tom Clark to the Oldham County Ambulance Testing District Board. Dr. Clark is current chairman of the board, is extremely well versed in everything regarding our ambulance testing service, relationship with Baptist Healthcare, our operation of our facilities in coordination with them, and he's done a great job, and I believe he has inside expertise that we need to keep on this board, so he's willing to stay. I'd like to appoint him to a term to expire November 9th, 2023.
Make a recommendation, keep Tom Clark on the animal taxing.
Second.
Discussion? All in favor, please say aye.
Aye.
Anyone opposed? Abstain? All right. Motion carries 8 with 1 abstention. All right. Next item here is to appoint a participant to the Henry County Water Board. That would be Joseph Debman. Joe is to fill the expired term of Ronnie Barrickman. I think most of us know Ronnie, who unfortunately passed away several months ago. Joe is vice president of agronomy at the Monty Food Company, and has been a long-time resident of Oldham County. Was also the manager of the States Co-op for a number of years, and is active in his church, and is all around good businessman, and I think will provide good service to the Henry County Water Board.
I move we appoint Joseph Depp to the Henry Carter District Number 2 Board.
I'll second.
All right, discussion. All in favor, please say aye. Opposed? Motion carries. Thank you. Now our second public comment. Today's meeting. Is there anyone who has come in who would like to address the fiscal court? Seeing no one, I'll close public comment and I'll wind up any comments from magistrate rates today. Magistrate Logston, Magistrate Hawkins.
Everybody who is a veteran, happy Veterans Day on November 11th.
Thank you. I believe that you fall in that category yourself, and thank you for your service. All right.
Two.
Thank you. Magistrate Hounds.
Sir?
Well.
Nothing.
All right. Mr. Woosley.
I do, actually. I have a couple of things. Department of Criminal Justice's training located in Richmond is where all of the full-time certified dispatchers in Kentucky go for training. There are 1,600 full-time certified dispatchers in Kentucky right now, and DLTJT offers several different trainings for classifications. And out of the whole seat, there is only one dispatcher who has qualified for single track, and that's our Mickey Tolles that works County Central Dispatch. So that's a pretty big achievement. So I just want to acknowledge that. Also, November is Safety Month. There's 30,000 accidents with farm equipment, and there are a lot of ex-farm equipment on the road these days. So I just wanted to make people aware that now there's extra tractors and things on the roadway. And finally, I wanted to recognize the student athletes who have recently either region or state finalists for all three high schools.
All right. Thank you. Manager Tice.
Yeah, one thing I'd like to talk a little bit. We had a special called meeting for Text proposal for the Westport Standby Park, and we hope to have another in a couple of weeks, and then we'll be having a following meeting for the public, which will be in that as we get a little bit closer. Hopefully it'll be the first of the year, and we're still moving on the development of Westport, and that's all I want to say. Thank you.
All right. Thank you. All right, Magistrate Likens.
Hi, Judge. I just wondered if you or our Deputy Judge Kevin Nuss could give us an update on the broadband request for proposals. Are those still being reviewed, or that's a topic that's near to all of us? And just wanted to get a date on that. Thank you.
All right, we did receive submissions from 5 different companies that we asked for, and 5 submitted. The broadband committee is in the process of reading those proposals. They have various different approaches within them as to broadband service would be extended to the underserved and non-served in a community. We're taking a very hard look at that, and we're not quite ready, but I hope that by the end of this month or early next month, we will have a recommendation and to go bring to court to see who we'd like to go forward with and get this ball rolling. And it's critical service. It's just like electricity was 100 years ago. Not everybody had it. Some didn't. But it's definitely something we need here, and so we're still in the process. And the committee has developed some questions and is looking at each one of the proposals. So I'm really not able to say much more about it at this. But we are. It's definitely in the center of our radar screen. Madge loosely just referred to a number of accomplishments that the Mickey Tolles has. Mickey is here today. That's you back there. Come on up here, Mickey, please, will you? I didn't have my glasses on, but I thought, okay. Mickey, Manager Woosley, you will review again all of those accomplishments that
Department
Nikki has, undertaken on behalf of our dispatch.
the Department of Criminal Justice Training offers certification tracks, things like leadership, and gosh, there's about a dozen or so that they offer. She's the only one in the whole state that's ever accomplished every single one of those tracks. And there's 16 full-time staff, full dispatchers.
There's 6 career paths that through KLEC, the Kentucky Law Enforcement Council, that they do offer through DOCJT. And by taking class DOCJT, you have to qualify. So in total, I have like 600 hours in my 2.5 years.
Well,
I mean, it took every bit of that to accomplish.
Well, Mickey, we salute you and we thank you for the service you're providing to the people of Oldham County. I know work days, night shifts, weekend shifts. You have certainly been a very, very, very key player and person we depend on dispatch, and you are a loyal, true Oldham County employee. And I won't say where you live. I think you live outside the county. I think you don't. You're now. You did at one time, but I don't know. I have an extra mile to be a good employee as you are. So thank you very much, and the fiscal court salutes you today. Appreciate service, and I'm glad that Magistrate Woolsey brought that to our attention because you're humble enough not to. Brought it to us, pushed on us, and I'm glad it has been because we want to know those. So thank you very, very much. All right. I think that's just about for today. We have a lot of balls in the air here. You notice the courthouse, most of the material that was taken down over at the county courthouse has been removed from the property. Soon the masons will move into that building and will do work on the interior and exterior of those walls. Keep it all together, and then Edwards moving and rigging will be coming and picking up the building, moving it back toward the fiscal court building in the middle of the block on Jefferson Street, and then a concrete pad will be built there. And it'll be moved again, the building onto the pad, probably sometime in the March, April period. And then the construction on the rest of the building will begin. It'll be a total of 55,000 square feet, I believe, in the entire structure there. So we have some other issues that or opportunity we're working on, and off ramp in the interstate, the Oldham Reserve, the broadband is mentioned here. There's huge project for us, and we're anxious just to get that underway. Did the roof come today at the building next door? Okay. Well, we've worked on putting an addition onto the Meth Church building, and waiting for metal to arrive. But the shortage about strikes home right next door to us. We haven't been able to get the metal, but we're told it's coming. And the latest is it's bringing it on tomorrow. Okay, be happy because we've got more work to do inside that building. We have been talking about work at the community center. I'm going to suggest to the court that we not go forward with that at this point because of the fact that prices are high, and there's going to thought we'd maybe wait till the first quarter of next year, March, April somewhere, to see if this is down, not go out and bid that. And when we really don't have to, we can afford to wait. We may have to wait on our animal control structure. We did go ahead. I'm sorry there was a split vote today, but on confusion about getting the property. Purchasing that property was approved by the court last year, I believe, or earlier this year. It wasn't a surprise. The court approved purchasing that property after it was appraised, and we're just pleading circumstance. It was set to this 30, and I think we need to do it. There was an opportunity that something might fall to cracks if we didn't show up in our County Attorney's Office has reviewed that entirely and is very, very happy with our payment and what we have there. So apologize if there was lateness, but we found that right before the meeting to make sure everything would be satisfactory. So with that, thank everybody for everything. Appreciate the good job our employees are doing and the effort our magistrates are making to lead our community forward. So is there a motion to adjourn?
Second.
Favor, please say aye.
Aye.